Sometimes kids go to a doctor and they see these little lesions by the trunk and they see a big patch called a Harrow patch, and the doctor uses this term, Pityriasis Rosea.
Okay. Pityriasis Rosea is a rash that comes out that if you go back, they had probably a mild sore throat about 2 weeks before. And there's an association with a mild transient bacterial infection 2 weeks before, and this is a reaction to it. So there is data out of Europe, if you treated them with erythromycin for 2 weeks, you may decrease the length of the rash instead of it lasting for 8 to 14 weeks.
Curing it, but shortening duration.
Shortening duration. It tends in Caucasians to stay on the trunk. They don't go above the neck, doesn't go above
How long
the
does it usually last?
8 weeks, max 14, rarely recurs a second time.
Okay, but it's usually self-limiting, right?
Yeah, then it's just a question of how extensive it is.
And there's another one called Pityriasis alba.
Pityriasis alba is probably a variant of eczema that just leaves whitish skin. So there was a really old cream which is hard to get on a lot of formularies now, that had an old antibacterial in it that was a yellowish tint, and it really worked.
That?
Called Vitone. It was hydroxychloroquine,
Oh, yeah.
and it worked really well for that. But you can't, it's hard to get, because what happens is when sales of a prescription drug drop too low, the brand disappears and the generic guys even give up. Because in other words, when it drops down to X hundreds of thousands of dollars a year in the whole United States, it doesn't pay even to make the generic anymore, and you can't get the creams anymore. They just pull them.
But it does work.